This month on The Spark, our theme is travel and transportation. We'll learn more about an organization supporting workforce development by using scooters to address the transportation issues that keep people from getting to work. A free phone service for older adults and people living with disabilities who need local, reliable transportation options to get to their destinations. And a company providing healthcare professionals with opportunities that empower them to excellence and allow them to travel and see the world. We'll also share a special moment from our Spark Awards 2019.
Lipscomb & Pitts Insurance is honored to serve the Memphis community for over 60 years. We've always focused on supporting our community and believe in promoting the positives, encouraging engagement, and leading by example. Lipscomb & Pitts Insurance is proud to be a presenting sponsor of The Spark.
Additional funding for The Spark is provided by Christian Brothers University, Mueller Industries, YMCA of Memphis and the Mid-South, Meriton, United Way of the Mid-South, MyTown Movers, MyTown Roofing, MyTown Miracles, Stuart Lloyd Cohen, Chief Motivation Officer, and by Serves.
Ever been excited by a new idea? Inspired by watching someone lead by example? When we talk about creating change, we start by sharing the stories of everyday heroes making a difference in their own way so we can learn and do the same. This truth is the power behind this show, which is focused on business and community leaders who are leading by example to give back, fuel change, and create new opportunities for the Mid-South. I'm Jeremy Park, and this is The Spark. They're using scooters to address transportation issues here in the Mid-South. We're here with Andy Nix. He's the executive director and lead flyer for My City Rides, and also Tony Reynolds with International Paper, who's also a flyer. So let's start with a little bit of history, though, for My City Rides, because obviously you have a really cool storyline using scooters. So give us a history lesson for My City Rides.
Absolutely. Well, we are just about to celebrate our second birthday operationally. What My City Rides is a nonprofit that's focused on helping people get to work. And we're doing that by helping people get on scooters. Think Vespa, right? And we've been doing that now for 2 years, and we've got about 225 flyers on the road who have ridden in excess of 300,000 miles, and folks are getting to work.
You're making it accessible for everyone to be able to have transportation and to own it. And I think that's something that's very different and special. So describe how this works.
Sure. Well, basically what our role is to reduce barriers to entry for people acquiring these vehicles and then being able to navigate the 36 months it takes to purchase it through a lease.
And then they go through a scooter school to kind of learn how to use it, navigate. That's where everything kind of comes in, and you talk about the license and getting the equipment. So walk us through kind of that first step.
Absolutely. If somebody's interested in the program, they check us out on the web, which is www.mycityrides.org, give us some brief information. Then they sign up for what we call Scooter School. It's about a 6-hour course, half classroom, half on bike, led by off-duty MPD and state troopers to prepare them to take the state licensure test, because you have to have a Class M endorsement in order to legally operate one of these machines, and we prepare them to go take that state test.
And then share on your end, Tony, you being a flyer, how has it benefited you, and talk about kind of why you decided to be a flyer. Give us a little bit of your story.
Sure. So I started looking into the program actually because I was working as a staffing manager at the time, and my biggest hurdle to keeping great people was that they didn't have reliable transportation. So I saw an ad for it and I was like, oh, let me check this out. And I said, before I recommend other people to it, let me go through it myself and kind of see what it's like. So I did that. I signed up. It took me 2 minutes online. Showed up, did a scooter school. It was fun, and I was a little kind of apprehensive, like I'm not sure if I want to ride a motorcycle, but I did the scooter school. It was fun. And then I enrolled in the program and got a scooter a few days later.
And talk about your experience in terms of what you would encourage for others, like how much you've enjoyed it, how fun it's been. What's been your experience on that?
So it is so fun. Like, I had no idea that I would love it as much as I do. You know, you're out there, the wind's in your hair, people are talking to you, because everybody loves to stop and chat about this scooter that you're riding. But most importantly, I think, is that I was able to actually get to work. When hard times hit me and I needed affordable transportation, I had the scooter. It allowed me to keep going to work and ultimately end up in a better position because I was able to keep getting to work.
And the key is that, for an individual, for mother, father who's trying to feed their family, getting to work is the key, and making it accessible and affordable. So walk us through on your end, because you're partnering with companies to do this too, which is very unique. So you're allowing individuals, but you're also working with companies, and you're exposing this to all the employees as an opportunity. So share a little bit of that kind of corporate partnership and the way that you're rolling these out.
Absolutely. Well, one of the key challenges that many employers in Memphis and everywhere face is reliable transportation for their workforce. And so what we have done is created a partnership where employers can allow their participants, their employees, to participate in our program through payroll deduction.
You yourself are a nonprofit, but I think what's interesting too is you have the virtue and the ability to work with other nonprofits in terms of opening this up and opening the floodgates. Walk us through kind of your mentality when it comes to being a nonprofit, but ultimately serving other nonprofits and working with individuals really of every race, economic level, because this is something that's open to everyone.
Absolutely. The program, number one, the program's open to anyone who qualifies, which basically means that they're 18 or older, they're employed or a full-time student, and are insurable underneath our program and have a base driver's license. That's it. You meet those criteria, you matriculate through scooter school, you pass the state test, you are eligible to be a flyer. And what we have found with our flyer population, we have over 225 out there now, and we have found that they really mirror the city in terms of demographics, economically, socially, racially, gender, and that this is a program that is for a wide spectrum of people across the community.
Yeah, and you kind of alluded to it is that we live in a good weather environment, and rain obviously is something to take into consideration, but what's kind of your answer when it comes to safety and those sort of questions? How do you answer those?
Absolutely. Well, number one, we would lean into our experience. We've had these 225 flyers out on the road for up to 2 years now. They've ridden in excess of 300,000 miles, which is, by the way, around the world a couple of times, and then to the moon, right? All in Memphis. We've been very pleased with how they have been received on the roads, how they have performed on the roads. We emphasize safety in our scooter school. We invite people to come back and ride more with our off-duty officers and in group rides in order to really continue to drive home those messages and safe behaviors and so forth. In terms of weather and conditions like that, while Memphis is a year-round riding community, there's certainly times when it's less advisable to be on two wheels. That's an individual judgment call, and we encourage people to think hard about that and try and help them make good decisions there. We also look at this as My City Rides is a really solid plan A, right? People are doing whatever they're doing now, but then you add this as their primary go-to option. They're saving money every time they use it. They're getting places efficiently. They are positioning themselves to be their best self at work or wherever they're going, right? Every time they use these, which then means that using rideshare or public transit, which may take a little longer, be more expensive, is easier to handle on an ad hoc basis.
Mm-hmm. Well, last question is the easy one, is where do we go to sign up to learn more about Scooter School and taking those steps?
Please go to our website at www.mycityrides.org, and if you are an employer or if you know someone who is an employer or a decision maker within a local business who thinks that they may benefit from their employees participating in this program, we really encourage you to hit us up on the website. We'll come out and share about the program and hopefully get you signed up.
We'll greatly appreciate you two coming on the show. Thank you for all you do.
Thank you.
Thank you.
They're a free phone service for older adults and people with disabilities who are looking for local, reliable transportation. With here with Justin Insminger and Courtney McNeil with Innovate Memphis and 901 Ride Choice. And let's start with Innovate Memphis, and then we'll dive into kind of how you got to 901 Ride Choice. So give us a little bit of history for Innovate Memphis.
Sure. Innovate Memphis started in 2011 as a part of the Bloomberg Philanthropies Innovation Team project. Memphis was one of the first 5 cities. And since then we've served as the public sector's innovation team. And what that means is that we come up with new programs, new services, new processes to deliver better service to Memphians. That's a data-driven approach, a human-centered design approach, but ultimately we just want improved service and better quality of life for our residents.
So you have a lot of smart people working on these problems, and one of them in terms of a solution is 901 Ride Choice. So give us a little bit of a context for 901 Ride Choice.
Sure.
Yeah, so like Justin stated, we just try to bring about these civic changes, and with that, we've done a lot of partnerships, so in a lot of programs. So emergency medical services, transportation, those are 2 programs that we focus on. And so with the emergency medical services, we did identify the need of needing reduced calls, non-emergency calls to emergency. So with 911 Ride Choice, it is an opportunity for us to reduce the non-emergency phone calls that are going to the emergency line, and also to tap into the untapped transportation options that we have in the city of Memphis that can cater towards the aging population and persons living with disabilities.
And so you've already had a number of calls. So in other words, right out of the gates, exceeding kind of the expectations, which was really good. So describe 911 Ride Choice in terms of what it is, and then we'll talk about the call volume and everything that you're experiencing.
Sure. So 911 Ride Choice is basically a transportation referral system. It's based off a national model called One Click, One Call. So somebody can call 901 Ride 901 or go to the website 911ridechoice.com and enter in or tell somebody about the needs they have. So they may need a wheelchair accessible vehicle or a stretcher accessible vehicle. They may need somebody to help them from their home into the ride. But then also it helps identify where the payment options are, right? So a lot of insurances will cover a ride to, say, a doctor's appointment or maybe even a pharmacy. Some are even interested in how you get access to healthy, food and grocery store visits. So we learn about the patient or the rider and then match them to the best ride that suits their needs.
So they can call in, you get their phone number, their email, so that way you have contact with them, and then you get all that information, and then you give them the options that then they can be able to make sure that they can get exactly where they need to go and do it with the convenience. And like you said, knowing that the insurance will cover some of that as well as a possibility, which makes it affordable. Carry that forward on your end in terms of where you are today with expectations, and then ultimately where we're headed with this.
Sure. Well, we're just over a year now in launching it as a pilot, and our call volume has exceeded our expectations. We partner with the Memphis Crisis Center here, and they're our call center, and they said that the volume we've hit, which is over 2,000 calls, is something that they usually see after 2 years, and we hit that in 9 months. So obviously the need is there. What we know moving forward is we want to expand both who we can serve, because it's not just the elderly, it's not just people living with disabilities who may need this service. We want to expand more transportation options so that if you call in, we have even more that might be the perfect fit for you. And then also, not everybody has the insurance that covers those rides. And so particularly if you have a specialized need, those rides can be expensive over time. So we want to look at other options with working with our philanthropic partners for subsidy.
So kind of carry us forward in terms of all the different options that might exist on the transportation side, including like the buses, obviously with MATA. So what sort of options, in other words, are there right now?
So of course you have your fixed routes with MATA and paratransit, but in addition to that, you have some cab companies who actually may have received 5310 funding in the past. Also have Southeast Trans, so we have transportation brokers, and then you have private companies as well, like Essential Home Health.
And then when you look at ultimately the ability for the technology to integrate in, and like you said, kind of the next evolution is to be able to match them physically and go there, what puts a smile on your face when you look at where this thing is headed, but the impact that it could have on our community?
Yeah, I think that being able to expand and really make it a collaborative effort, we've been lucky to have wonderful partners, not just with MATA, but with a lot of our referral agencies too, like MIFA and the Aging Commission. And they know that it's not just their specific population, but that they have seen for their population, this works, right? We have a great story of a gentleman who needed to make a trip to the Veterans Hospital to be approved for in-home care, but he had to make that trip. And he needed a specialized ride to do so. We were able to help connect him to the right ride for him, where his caretaker could go with him, and now he gets in-home care. That could be expanded to any number of rider type or patient type, and the fact that it's working and it's a service that we really see is making people feel more independent and have access to the health care they need. That's what puts a smile on my face.
And the fact too is that it's reducing the emergency calls, so you're taking that offload of the system, which is dramatically helping from an efficiency standpoint, and from making sure that the really high need ones are answered in a timely manner. So I think that this has a big ripple effect for our community. One last thing is, how can we help? Because you mentioned on your end just one, knowing that it exists, so referring it to others, that's a big piece of this. What else can we do?
I think, if you have a family member who is in need of care, or you work with a caretaker or social services agency, that's one thing, right? Call 901, Ride 901, or visit the website for 901 Ride Choice and find out more about your transportation options, because a lot of people just aren't aware of what's out there. But secondly, if you work on a funding side or a corporate side, we do need those ride subsidies for those who can't afford specialized trips. And so we'd be happy to work with you to make sure more people have access to the rides they need.
And you mentioned the phone number, mention again the website and where to go.
901ridechoice.com or innovatememphis.com.
Well, greatly appreciate you two coming on the show and for all you do. Thank you.
Thanks very much.
The Spark Awards annually recognize and celebrate individuals and organizations that have made outstanding contributions to the community. This year's recipient of the Nonprofit Award for organizations with budgets between $1 and $5 million is Pure Power Foundation.
Pure Power is an organization now starting its 15th year in schools. We are in classrooms of 5 high schools this year: Ridgeway, East, Whitehaven, Kingsbury, and Douglas. And in those 5 high schools, we're in the English, Math, Science classes. And we affect about 5,000 students and 130 to 40 teachers each and every day. The collaboration between Shelby County Schools, the University of Memphis, and Pure Power is a unique one that many across the country have come to see. And it allows us to work together in a more simplistic way that creates a symbiotic relationship that we look for in a town like Memphis, which is so generous. Success Coach is what we call our University of Memphis students who we've recruited, trained, and employed, and we've placed them into classrooms, and we pay them a wage between $11.50 and $15.50 an hour to be in the classroom. The impact there is that students in high school see college students who are being successful, and it's also, as David Rudd has said, it's not just the one being helped that's helped, it's the one helping. Really, it's almost the grit and grind. We put in over 2,200 hours per week in classrooms. So we're in there every day. We're not once a week, we're not once a month. We're in there every day working with the teachers, working with the students, and the results become evident by the end of the year. Probably the thing that gives me the most pride is that teacher retention at the schools we're in is extremely high. Extremely high, and in order for schools to be successful, they have to have continuity. The next is our graduation rate is about 12 percentage points higher than their peer schools. And finally, the University of Memphis students that we employ, our success coaches, are graduating at 83% rate in 5 years, which is 32% higher than their peers at the school and 35% higher than the national average. ACT Prep is given 4 times a year, and each time has 6 sessions. And we open it up to 300 students and for students all across Shelby County. And they are tutored in English, Math, and Science and given ideas of how to best take the test. Well, as we collaborate with the University of Memphis and Shelby County Schools, our dream is to be able to have Pure Power into all the schools that are needed here in Shelby County. Our teachers are just wonderful in Shelby County Schools. Together with the community, we can really make a difference in getting students across the line to graduation and continue to show the world why Shelby County is a wonderful place to live.
They're a company providing healthcare professionals the opportunities to succeed with excellence and travel the world. We're here with Brian Burnett. He's the Vice President of Travel Nurses, Inc., an OR Nurses nationwide company. And Brian, let's start with a little bit of history for the organization.
Sure. So the OR Nurses Nationwide was started back in 1988 by an Army nurse, Carol Patterson, and another OR nurse, Denise Burnett Stewart. And their vision was to basically empower the nurse and give the nurse the power to make their own schedules and even negotiate their own pay. And fast forward, she unfortunately passed away of cancer and left the business to Denise Burnett Stewart. And she from there just kind of grew it to where it is today. And now we have our division, Travel Nurses Inc., that covers the entire United States.
And you have multiple offices, but obviously headquartered here in Memphis in the Mid-South.
Yes, our headquarters is here in Memphis, and we also have an office in Dallas, Texas. And we have a remote recruiter over in outside of Miami, Florida.
Talk about, because obviously on your end, empowering nurses, but it encompasses a lot more than nurses. And then talk about on your side kind of how this works and the freedom, but also too the ability to strive for excellence.
So yeah, the hospitals, a lot of times they will be either short-staffed for various reasons, and so they'll call us and ask us to fill that need with a nurse. And so basically that allows that nurse to basically choose when they want to work, what day they want to work, the shifts, and they even get to, kind of negotiate their pay because there's a bill rate there, so they kind of get to negotiate their pay based off of what they need.
Talk about the different areas, because traveling is a piece of this, so they have the freedom not only schedule-wise, but to literally see the world.
Yeah, so a lot of times, and a lot of the millennials that are coming up are doing this, and they're getting their RVs and just traveling all across the country and getting paid to do it. We have a bunch of nurses, actually a couple nurse that's married, that's traveling to Alaska. And they're going to stay there for about 3 months, and some of them stay even longer than that, up to a year.
Well, also, I was going to ask is what's a typical duration? Is it a short stint, or is it a very long stint? Is it kind of the flexibility is whatever you want it to be?
Typically, it's usually 13 weeks. They do have the ability to extend if they choose to. But I do know for tax purposes, they do have to go back home just shy of a year, and then they can go back. So
there's a lot of business to this in terms of managing the numbers, but managing the people and making sure that everybody's on the up and up.
Yep.
Talk about how it works on your end in terms of managing those expectations, because on the healthcare side, obviously they're looking for best in class. They're looking for people with a servant's heart who can step in with that expertise and skill set. On the other side, as you mentioned, it's a matter of managing schedules and expectations and where they want to go as well. So talk about kind of the balance on both sides.
Yeah, so a lot of it is us being able to know the facility. The better we know the facility, the better we can place a person that will fit in that culture. And we're very careful about doing that. Whenever we talk to the nurse, we're always careful and diligent about asking certain questions to make sure that they're going to fit in where we're placing them, and not be a clash to the culture, but rather just fit in and have it be a smooth transition.
Talk about on your end philanthropy, because especially when you talk about the healthcare profession, it's taking care of people. Mm-hmm. And on your end, you're taking care of your people, but you're also taking care of people in the community as well. So share a little bit of your heart with the philanthropy, and then we'll dive into the Daisy Award.
Yeah, so we wanted our people that are in our corporate offices to kind of experience a little bit about what the nurses do. The nurses are constantly giving back and taking care of people, and we wanted to pretty much do the same thing in our own way. And so we do pay for 8 hours of volunteer time a month for our corporate staff to go out and volunteer wherever they choose to volunteer. And I know City Current's been a huge partner in that as far as getting us a lot of opportunities out there.
Share the Daisy Award. This is something special, obviously, on your end.
Yes, Daisy Award. We were the first agency to do this. It was in the hospitals before, and it kind of stemmed from this individual who had a disease in the hospital and couldn't eat, and the nurses just went above and beyond and took good care of him and brought him these cinnamon rolls. That's all he could eat. And he ended up passing away, and his parents started the Daisy Award to honor nurses for extraordinary nursing. So any nurse that goes above and beyond, they can be nominated by their peers, and then they win this award. It's a healer statue that's handmade in Africa. And they get that along with a Cinnabon deal and just recognition and this little lapel pin that they get to wear. So anytime you see that, you have a really good nurse.
What about scholarships? That's another piece of what you do.
Yes, we have a scholarship for Carol Patterson. We also have one for Jared Walton Burnett for psychiatric nursing. And then we also have 2 discretionary funds at Lowenberg College of Nursing, and those are for the dean to give out as he or she sees fit.
Because obviously on your end, to be able to make sure that you're always kind of creating this future opportunity in this pipeline, but also to engaging as many students and future nurses as possible.
Yes. Yeah, that is absolutely the case. And we want to make sure that we're giving back to the nursing community as much as we possibly can. And so that's a lot of where that stems from. And also we do have a skills lab that we sponsor at the University of Memphis that's almost done. So that'll be a OR skills lab where nurses can go in and have a simulated OR experience.
Awesome.
Yeah.
When you look at like taking it to that next step, what puts a smile on your face when you look at travel nurses and OR nurses and kind of where that's headed? What puts a smile on your face with the growth, the trajectory ahead?
Honestly, just knowing that our nurses are out there filling a need and taking care of patients, because one day that's going to be, my family members or myself. And, if a hospital's not, fully staffed, that's not a good thing for anybody. So, whenever they're staffed fully, that's the fulfillment that we all get, knowing that that's being taken care of and being done in the right way.
And so the last question is the easy one, is where do we go to learn more? For anyone interested, obviously, in this being a career path, but also for healthcare organizations, how do we reach out and get in touch with you?
You can go on our website, ornurses.com or travelnursesinc.com, or our Facebook page at Travel Nurses Inc., or even our Instagram at Travel Nurses Inc.
Brian, thank you for all you do for coming on the show.
Thank you.
As we saw this month, travel and transportation are critical to the success of our city and our fellow citizens. Having reliable transportation is what allows us to get to work, earn a paycheck, and feed our families. So having an affordable option like what My City Rides is offering adults with their scooters is paving the way for people to take advantage of new career opportunities to better themselves and their families. 901 Ride Choice is connecting older adults and people living with disabilities to reliable transportation options so they can get where they need to go safely. Then Travel Nurses is leveraging both transportation and travel to give healthcare professionals opportunities to grow professionally and personally while giving back in their communities. It's a powerful thing when organizations power the good. So thank you for watching The Spark. To learn more about each of the guests, to watch past episodes, and to share your stories of others leading by example, visit WKNO.org and click on the link for The Spark. We look forward to seeing you next month, and we hope that you'll continue joining with us to create a spark for the Mid-South.
Lipscomb & Pitts Insurance is honored to serve the Memphis community for over 60 years. We've always focused on supporting our community and believe in promoting the positives, encouraging engagement, and leading by example. Lipscomb & Pitts Insurance is proud to be a presenting sponsor of The Spark.